welcome back. You know what? We were always told to eat our carrots so our eyes will be good. As you can see, I'm a 52-year-old guy. I got eyeballs about 12 years ago. And you know what? There's a lot of misinformation, but there's a lot of things we need to know in order to make sure we have vibrant eyes and you can see the world for years and years to come. So that's the reason why we have Dr. Jeffrey Anshel. He's been practicing optometry for 40 years. He's written 5 books, 2 have been bestsellers. We're just lucky to have him. He's the principal of the Ocular Nutrition Society. He's a principal of Corporate Vision, which is vision in the workplace. Jeffrey, welcome to the show. Thanks for being here today.
Great, thank you. It's my pleasure.
Glad to have you. Now, biggest question, how often should we have our eyes examined?
Yeah, it is a tough question because most people think if they see well, they're doing fine. They don't need an eye test. But most of the vision problems that happen are painless, and they're also slow to develop, so that people won't realize that something's going wrong. They may get a headache or get tired at the end of the day and not realize it's really their eyes that's causing the problem. So just to simplify things, I just tell people, get your eyes checked every year.
Okay.
Easy.
Now, one of the other things is there's a bunch of different O's when it comes to eyes. Could you explain those?
Sure. There's ophthalmologists, and those are MDs who go through medical school and then spend some years afterwards in a specialty to learn eye diseases and eye surgery.
Okay.
Optometrists go through optometry school for 4 years plus an internship, and they specialize in eye examinations, contact lenses, glasses, and also detecting and treating many eye conditions as well. Mm-hmm. And then there's the optician who basically fills the prescription from the ophthalmologist and the optometrist.
Okay, now this is the one I've been wanting to ask you all week. And you know what? Are carrots really good for the eyes? But is there something else that's good for the eyes as well from a nutritional standpoint?
Well, people tend to think that carrots is the #1 nutritional product for eye health, which is good. Carrots are very good. And they contain beta-carotene. Now, beta-carotene is a molecule in the category of carotenoids. Mm-hmm. And this carotenoid changes from beta-carotene to vitamin A in the body. And vitamin A is in the molecule in the eye that transforms light energy into nerve energy. So it's a very important molecule. So you would think that having beta-carotene from carrots will give you a lot of vitamin A and then you'll see better. Well, it doesn't quite work that way because typically in the United States, most of us have enough vitamin A in our bodies because it's not water soluble and it's stored in the body, in the liver.
Oh, I see.
So it's there. This conversion from beta-carotene to vitamin A doesn't quite happen as readily as we get older, but also there's no actual beta-carotene in the eye itself. So it's healthy for your eyes, but it's not going to change the prescription or the way you see.
Okay, so what's the best things to eat for your eyes, though? Well,
what we're finding is the other carotenoids called lutein and zeaxanthin. These are 2 other carotenoids, and they are found mostly in the dead center of the retina and in the back of the eye. Okay. And these come from mostly kale, spinach, collard greens, the dark leafy green vegetables. Very important.
Okay, good. I'm glad I'm a spinach eater. This is good. I'm good.
Yeah.
Now, what diseases are affected by nutrition when it comes to the eyes?
Pretty much all of them, because as we know, the eyes are connected to the body. So what's important for your general overall health is also good for your eyes as well. The common ones are glaucoma, cataracts, macular degeneration, diabetic retinopathy, which is the eye disorders that happens with diabetes, and also dry eyes. All of these things have nutritional components to them.
Now, when it comes to computer use, and this is what a lot of wives' tales, you know, when it comes to computer use, how does it affect your eyesight?
Well, you know, Ben Franklin, when he invented the bifocals back in the 1700s, didn't think that we were using computers. So, you know, we tend to look down when we're normally reading, and we need reflected light off of the paper and the book into our eyes. Computers are a whole different thing because they have their own light, and they're typically higher in the visual field. So there's a lot of differences. But the fact is, when we're looking at computers per se on a desktop, for example, our eyes are in a whole different posture, and we're locked into one viewing position for a long period of time. So that's really where a lot of the vision problems happen, is your focusing is locked into that position, and you're just kind of going back and forth, not flexing your focusing. And that's where the muscles get tense, the eye kind of gets locked into that, and then you go to look far away at the end of the day, it's blurry out there because your eyes are over-focused from seeing up close.
It's almost like a muscle cramp while you're reading there for a long period.
Similar, yeah. It's an easy way to describe it.
Well, just to go on that site, on that vein, you know, what can you do do you need to look away from the computer every 10 minutes or so?
Well, I call it the 3B approach.
Okay.
Blink, breathe, and break. Okay, now blinking is very important because we do get dry eyes when we look at computer screens because we don't blink as much. Studies have shown that we blink about 1/3 of our normal rate. Now, breathing is important because it maintains oxygenation of the body and the eyes. And then taking breaks, I boiled it down to the 20-20-20 rule. Every 20 minutes, just take 20 seconds and look 20 feet away. That'll help your eyes relax a little bit so you're not overstrained and make sure you can still clear things far away.
Okay. Now, people who use, like, you know, they get red eyes, so they use those things to take the red out.
Right.
Okay. Is that good or bad? How does it affect the eyes?
Well, it actually makes your eyes redder.
Oh, okay.
Which is kind of strange. What happens is the drug, or the ingredient that's in there artificially shrinks the blood vessels to make your eyes whiter. But by the next morning, your eyes have rebounded, and now the blood vessels are actually bigger, waiting for those drops to come.
Oh,
so what we call it is a rebound phenomenon. So while it'll temporarily, and then I get patients in the office all the time who said, I'm using those drops every day and my eyes are getting redder. It's like, well, you're acclimating to it.
Oh, I see.
So really, if your eyes are red, there's a reason. The redness typically is a side effect of what's going on. So that's why we have to talk to the person, look at their eyes and find out what's going on. Very often, it's dry eyes. And that's a very common, much more common than people give it credit for.
Now, we just have another minute or so. What are some of the signs that people need to come and see an optometrist for? Well,
optometrists are the general practitioners of eye care. So if you have any, certainly blurred vision, headaches, difficulty focusing far and near, anything like that, even color problems, anything, we're the first people to see. A lot of the conditions we can treat. And if we can't, we work with ophthalmologists who are the surgeons, and we'll work with the surgeon to figure out what the best course of action would be.
Now, if somebody were to go get your book, where can they go get it?
Typically, Amazon's an easy way to go. They can go to Amazon.com, look at my name, my full name, because my brother's written a lot of books as well. So under Anshel, there's a whole bunch of books, but mine is Jeffrey Anshel.
Or they can go to Smart Medicine for Your Eyes.
SmartMedicineForYourEyes.com.
Thanks, Jeffrey. Thanks for being here. Thanks for sharing with us. Look, if you would like to get Jeffrey's book, you can always go to the website at Smart Medicine for Your Eyes, or go to the Silver Hair Tsunami website to get more information on Jeffrey. Now, stick with